So why are patients, this of course begs the question is why are patients not referred to experienced surgical centers? And part of this may be that the seizures don't look so bad. The person has a short seizure for a minute or two and then comes out of it and don't realize that they're at risk for really having a very dangerous and poor outcome. There's a knowledge gap in patients and in physicians as well. And this gets back to the neurologist who reduces the patient's seizures from 5 times a month or 5 times a week to once a month and looks like a hero, but that's not really adequate. And then the real issue, I think, is that human beings are very poor at assessing risk. There are also barriers to specialists. It's hard to get an appointment with one of us. There aren't that many of us with the requisite skill set. And there's a normal, rational fear of surgery. So just to get to the issue of humans really being very poor at assessing risk, there are a couple of clear biases. So you can do these sort of game theories where you offer situations in a card game where if you keep playing, the longer you play, your likelihood is going to be better over time with certain strategies. But in general, human beings will give up a potential $2 gain over long-term in many rounds just because they're adverse to the risk of losing $1. And similarly, there's a status quo bias. So you get used to what you're used to, even if it's terrible. And both doctors and patients and families of patients really get used to terrible epilepsy. A good example of this is what happened in the United States after 2001, after 9/11. And when the 4 airplanes were hijacked and flown into various buildings, 3,000 Americans died. And what happened in this country is that as a result, rationally, people avoided planes and they drove more. So they went on their summer vacation, and instead of flying, they would go on a road trip. And the problem is when you look at the risk of death, it's much, much higher in a motor vehicle accident, even though as the driver you fool yourself to feeling that you have a lot more control over the situation because you're the one with your foot on the accelerator and the brake. And in the year after 9/11, 1,600 more Americans died than in the prior year from an excess in motor vehicles because people were avoiding flying. And what this points to is really just that the risk of being involved in a motor vehicle accident is much, much higher than your risk on being in a plane that goes down. Even if there's one plane hijacked a month that goes down, your risk would still be much lower than if you're on the average risk of being involved in a fatal motor vehicle accident in the United States. So how do we improve this sorry state of affairs? Well, part of it is doing talks like this and better educating clinicians and patients. But I think a lot of it is also understanding patient preferences. We also need to do a good job of really determining who will and who won't do well with surgery and not offer surgery to patients who aren't going to do well. And we've tried to work very hard at Henry Ford in improving the technology and reducing the risks and discomfort.